The patient-centered medical home is a model of care that incorporates comprehensive, well-coordinated care that is about the patients.
The medical home represents a set of concepts that are based in large part on similar ideas expressed in the Future of Family Medicine report in 2004. That report was looking at the future of our specialty, family medicine, primary care, and a need to look at how we could adapt to a changing environment of healthcare.
Back in 1960, when primary care was just general medicine docs, there was a great debate on where should we go? Is it the general medicine was going extinct?
The current healthcare crisis has been developing over many years, and it's certainly now reaching a stage where more of us acknowledge that our current healthcare system is progressively bankrupting our country.
The data we got from the registry showed we weren't giving nearly as good a care as we thought we were, and that was impressive in a not so good way.
We were in paper charts, we had limited hours, we were calling our patients 2 days later with lab results and leaving messages on voicemail, and we wanted to do better.
We're trying to practice medicine with a new model in the current extremely dysfunctional healthcare system.
The patient-centered medical home encompasses all the principles of family medicine that drew me to the specialty in the first place. So once I started to hear about this model of care, it was a no-brainer for me to get involved.
Without the patient-centered medical home, there really cannot be payment reform, and there cannot be healthcare reform without having some operational structure that is standardized across the nation.
Patients talk to me about how much it means to them to have one office that sort of serves as their home base, to coordinate their care.
I have 6 physicians and we maintain 4 locations. We go to 3 hospitals and we go to 11 nursing homes. People would look at that from the outside and say, well, how can you do that?
Really what's helped the most for me is my electronic medical record and using health information technology to aid me in taking good care of patients.
By using the registry to assist in providing care, we were able to improve the quality of the care we were giving, and we could document it with data.
The patient should still be able to experience a close relationship with their provider, one that involves attention to their specific and individual concerns.
If I am able to provide well-coordinated comprehensive care to a patient, then that allows me to communicate that to other specialists or the hospital or other healthcare providers as needed to reduce the fragmentation of care.
The patients really don't see much. It's almost like not having a headache or that relief of pain that you have. They have high levels of trust. They are comfortable here. They really are just noticing the things that they expect that the physician should give.
A big part of what we do here is help patients with their self-management. So my patient care coordinator helps teach patients about their disease processes, make sure they understand their medicine, to provide good patient education, which helps them manage their diseases on their own when they're not here in my office.
The medical home movement, as it provides a new model of the provision of primary care services, focuses on improving the value of the care, such that we're providing care that is of higher quality and of lower cost.
It does address the issues with fragmentation of care and inefficiencies in the way that we duplicate care so often.
For us, the decision is simple, and I would encourage other physicians to do the same, to get out there, roll up their sleeves, do the right thing, and once they make that investment, what they will see is improved patient satisfaction, improved employee satisfaction, loyalty, improved safety, improved efficiency, improved access. And once they create that in their local community, it starts to have spin-off effects that then can allow them to go forward for building accountable care in their region. And that long-term is going to create some sustainability that we need as a nation.
It's easy to practice here. It's become a really recapturing the joy of medicine again, in terms of really wanting to come to work and being able to do what I want to do as a physician. And there was just no way I could do that without having a medical home structure.